Now let's talk about a very important doctor that uses Kangen water in his practice, Dr. Hiromi Shinya, MD, PhD. Dr. Shinya retired in 2012 as the professor of surgery at the Albert Einstein College of Medicine in New York City. He was also the chief of the endoscopy department at Beth Israel Medical Center, also in New York. Dr. Shinya is one of the top 10 surgeons in the world, one of the top 10 GI doctors in the world. He actually co-invented the colonoscopy. He was the first doctor in the world to perform a colon polypectomy, which is the removal of a polyp using the colonoscope. It's actually called the Shinya Method. Ask your GI doctor if they've heard of Dr. Shinya. Of course they have. He wrote the book on it and he invented the technology. Dr. Shinya has overseen or performed over 370,000 colonoscopies. He's kept clinical data over a 45-year period of lifestyle and what people put into their bodies compared to their colon health, and he knows the direct correlation. Now, part of his protocol for cancer patients is they had to agree to drink 3 liters of Kangen water every single day. Now, this is some of Dr. Shinya's work. This is a colon of a 45-year-old female with breast cancer and chronic constipation after 2 days of prep. That's 2 days of laxatives to clear out her colon so they can take some pictures of it. This is 90 days later, 3 months after treatment. Now, Dr. Shinya does not sell the water. He's not a distributor for the company, but he knows the power of this technology. One more. This is the colon of a 65-year-old female cigarette smoker with breast cancer. You know how with cigarette smokers they say the lungs turn black? Well, the colon also turns black. The body is overwhelmed with toxins. 3 months later, 90 days later, and she has a very clean colon. Dr. Shinya figured out how to get rid of the toxins inside the body. Take a look at this short video on more of his work.
In 1968, Dr. Shinya successfully developed the technique of colonoscopy in order to visualize the entire rectum and colon. The following year, in 1969, he devised a snare cautery device and was the first to perform colonic polypectomy through the colonoscope. He has performed approximately 300,000 colonoscopic examinations and has noted that there appears to be a strong connection between intestinal appearance and lifestyle-related diseases. This video depicts a variety of different intestinal views, good and poor, related to various colonic and other diseases. This patient had been a heavy wine drinker with a heavy animal protein diet, including cheese. After 3 months treatment, the patient was treated with Dr. Shinya's diet without any alcohol, dairy, and animal protein. He was given 1 quart of Kangen water and his condition improved. This is a 38-year-old Japanese woman who has been suffering from chronic constipation for many years. Her diet consists heavily of a Western-type menu, including white bread, yogurt, cheese, fruits, and cake once a day. She consumes 3 to 4 cups of coffee and tea a day. There was insufficient daily intake of water. She has been on various kinds of laxative every day, including Seneca, aloe, and other herbal medications for years. There are marked pigmentation and spasm. This is the same Japanese woman. She was instructed to drink Kangen water 3 quarts per day. Her diet consists of 90% grains, vegetables, sea vegetables, and fruits, and 10% animal protein with fish. Her condition has markedly improved. 45-year-old female with breast cancer. 6 months prior to this exam, she had a lumpectomy and radiation treatment. There are marked fecal retention in this picture. The same patient following Dr. Shinya's diet started to drink 3 quarts of Kangen water a day. Her condition markedly improved. This 65-year-old female with chronic constipation had breast cancer surgery and was referred for colonoscopy. Examination showed marked stool retention in many areas of the colon despite 2 days of preparation. The same patient was treated with a typical Dr. Shinya's diet and 1 quart of Kangen water 1 hour before each meal. Examination was repeated in 3 months. There was marked improvement in the colon.
The only thing I can tell you now is I am convinced that Kangen water helps you to maintain good intestinal characteristics. The most important thing I can tell you to live a long and healthy life is to do what makes you happy. You are what you eat, drink, and what you think. I hope my health method and the Kangen water will guide you to your happiness and healthy lifestyle.